So now I hope you can see the screen, and we're going to start with the writing types of letter. Basically, as we discussed quickly, that we have different types of letter. So let's start with the referral letter and its category. Let's say a referral letter when we have to write a letter with a diagnosis, a referral letter without a diagnosis, right? Number C is with differentials, with differential diagnosis. Number fourth is your emergency referral. So these are few types of referral letter we can expect in OET writing. So we can discuss those things one by one, right? So first of all, like writing the letter that is called as with diagnosis. What I mean by that, when I mention that with the diagnosis, let's say if you are writing this letter to the specialist with the provisional diagnosis of diabetes, so now we have some confirmed diagnosis being given. So whatever we are going to select, right, it would be same. Let's say either the risk factor, we can know that what are the risk factor for the diabetes that the endocrinologist would be interested to know. Let's say the medical history, socioeconomic history will be the risk factor, right? And you can say if there is any treatment or the investigation history, we can also mention with reference to the diabetes. Similarly, in this case, if we are writing this letter to the, let's say, and we are suspecting AMI, beside the fact it would be emergency referral, but still we have some confirmed diagnosis given, acute wall myocardial infarction. In this case, we can just simply write down in the introduction, in this approach, let's say, thank you for seeing Mr. let's say XYZ, whose features are suggestive of, let's say, acute infarction for further, let's say, management. This will be the introduction part that you can write in the confirmed diagnosis or the diagnosis given. We also have a case when we don't have a diagnosis given. So we can write it down without a diagnosis. It means that if we have the symptoms given, let's say if there is a pain like this chest pain, crushing in nature, these are symptoms, let's say, and even to the point like ECG, ST elevation. If these two symptoms and investigation being mentioned and there is no assessment, so we cannot write down something from our own knowledge. If this was the provided case notes, this was the provided information, and now we are writing this letter, I cannot write down AMI from myself, although it could be 110% AMI, but if it's not mentioned in the case notes, so we will not write it down from our own knowledge. So what would you do? You can just write down thank you for seeing maybe Mr. X who presented today with crushing chest pain, right? And his ECG showed ST elevation, let's say. Okay. Therefore, I would appreciate if you could provide a definitive diagnosis and further management. So in this case, we can simply write it down, the symptoms as it is in the introduction. Afterward, we have the third category. In this category, we have differential diagnosis. In this category, we have differential diagnosis. So we do have different things in the DDs. The first of all, if we have some primary issue and it is being divided into two things, maybe let's say if we have inflammatory bowel disease and it's basically you are suspecting Crohn's or ulcerative colitis, it's also a DD differential letter. We can have the maybe issue such as obstruction, and here they have mentioned the reason of his obstruction such as diverticulitis or carcinoma, and we have maybe different differentials: 1, 2, 3, 4, 5, 6, 7, maybe 7 differential. In all these differential letter, we may write down in the introduction the primary symptoms, although we have to mention the DDs in the conclusion. But if you are not willing to write down the, you can say DDs in the introduction, it's totally fine. You can write down the introduction somewhere down the grade. Is it clear to you?
Yes, sir.
Yeah.
सर ये करने का फिर बताइएगा.
Next type of letter as well. That is, you can say, emergency referral. Emergency referral can be in the form of we can have the diagnosis as well. Even we can have the symptoms, such as if we have the AMI, still it's an acute condition. So we have to focus on the symptom related to AMI, the most probably the recent history. Similarly, if we have the acute chest pain and some other symptoms such as sweating, shortness of breath, and so on, and we don't have the diagnosis given, still we have to focus on the current symptom. So this is an emergency referral. Most commonly believe in the emergency referral after introduction. Start from the recent history, right? But according to some cases, we can write it down: intro, overview of past history, and then today. But in this form, it should be very concise and summarized, right? So this is your basically type of letter that we can expect in this part of referral. Afterward, we can have the discharge letter. Now, this is the most common type of letter in OET nursing, but we can also expect in the medicine. So we'll discuss. Let's say in case of medicine, how can we approach it, and in case of nursing, how can we approach it? We'll discuss. So first of all, let's say it's a kind of referral back. We discuss referral letter. So specialist is writing back to the GP. So in medicine, in the primary care physician, GP is the primary care physician, right? So in this letter of discharge, past history, social history would not be relevant. Okay, past history, social history will not be relevant. We just have to see that we have the details such as ward, we have maybe nursing management, right? We have the details such as rehab and the discharge plan. And similarly, for the nursing discharge letter, it's a ward nurse might be writing to the community nurse, to the district nurse, right? So to the nursing home. Minus nursing home, we do write it down the social history and past medical history. Where to write, that is question. But in the letter of discharge, we can see there that we have the following thing that has to be followed. The first of all, the first thing is you can see that the ward details in any of the case. If we have a ward history, if you're writing the medicine or nursing letter of discharge, it should be summarized. We should not write it down something in detail. It should be summarized. Okay. In case of basically writing a letter, when we are writing, we have to summarize the word details because it's less relevant. It is less relevant when we are writing this letter. Okay, is it clear to you? Either it's a OET medical letter that in case of letter of discharge, the word history will be less relevant. So, what would you do? You would summarize whatever the case it would be. So, similarly, the nursing management, the nursing management, it would be comparatively more relevant than word. So, though you have to summarize, but more than your lesson words say. And sometime we have rehab. It also have to summarize, but less than your words say. And at the end, after writing this thing, we should write down the discharge plan. Now, discharge plan we have to expand. In the discharge plan, we have to expand. So the point that we need to discuss over here that in the letter of discharge, you may have ward history that is quite like large, like we have a lot of things. Okay, so for example, if you will receive the letter in the writing task, you can see that under the ward there might be a lot of things. Let's say 1, 2, 3, 4, 5, 6. So these are the 6 days that you have managed the patient in the ward, right? These are the 6 days. So we might summarize over the period of let's say 6 days, his stay remained uneventful. Over the course of ward stay, there was nothing significant finding, and his stay was uneventful like that. So we have to summarize the ward stay, right? So it's a conventional letter of discharge. When we have to write it down, the discharge plan, and along with discharge plan, you would also write the follow-up. So whenever you are planning a letter, for example, you are standing on this day, that is your exam day, or today's date in the letter. You can see the thing that is close to today's time is the discharge plan. Simple logic. It's very important. So the thing that is very important, most recent expansion, though they might have only 3 points you have to expand. And the thing that is far away from you at the current time is your ward. Comparative to discharge plan, ward is far away. So summarize, right? So we need to summarize the things down comparative to ward stay. Is it clear to you? So it's a simple logic. The discharge plan might not be a difficult thing to write it down in term of you can say like the conventional pattern that it should be written in the sequence, number one, but the ward history should be summarized and the nursing manager and rehab should be summarized also, but the discharge plan have to expand. So it should be a graded sequence in term of summary. Okay, it should be a graded sequence. It should be a graded sequence, like a summary. We have a discharge plan. We start with the ward stay. We have to expand them, and then we have to move on toward the rehab, summarize, and followed by the we can say like the discharge plan, right? We have to expand them down. Is that clear to you? The categories, हैं? We'll also discuss them as well. So when we are writing, though it should be in the request letter, letter of discharge, but it's not a conventional letter of discharge. I mean to say that GP is writing this letter to specialist. It's a referral letter, and specialist is referring back this letter to GP. It's a referral back or discharge letter. So now, if specialist is referring back this patient, that is a conventional discharge letter in medicine, and if the ward nurse is writing to the community nurse, is a conventional letter in the nursing. But if you can see that now specialist is writing this letter to the, let's say, social worker, or maybe ward nurse is writing to a social worker. Let's say specialist is writing this letter to the physio, same. Maybe occupational therapist, same. So you can see now in this letter, maybe the wound care and the dressing and the exercises will not be important, but these points will be important. For the sake of example, let's say the patient has hip replacement, right? Surgery is being done and it was uneventful. Now, in the first approach, this letter was written to the primary care physician by the specialist in case of medicine. Same letter for the nursing, if it was written to the lady district nurse, right? But in these both cases, we have to see the follow-up care with reference to the rehab and the wound care and dressing will be important. But if I am writing this letter to the social worker, as the patient has acquired depression during his stay in the hospital, now we can see that the socio-economic details will be more important than the dressing and all this thing, right? Is it clear? So even if you're writing a letter of discharge, but you're writing this letter to a social worker, why? Because the patient has developed, let's say, depression during his stay in the hospital. So in this phase of time, in this depression phase, we want this social worker to help the patient so that he or she can resume normal life, right? So that the patient could resume normal life. So in this regard, we have to see that how can we write down the letter by putting focus on the socio-economic details. Is it clear to you?
जी सर.
Yeah. So moving on, like to the request letter, we have to see in the request letter, most of the time we are writing this letter to the allied professionals. Let's say for the occupational therapy, for to the social worker, for the geriatric review, right? For the pension care, diabetic food care, and so on. So in this letter of request, we are requesting some other healthcare professional to pay a home visit to the patient home. Is it clear to you? So basically, it's also a referral letter, but most important thing will be the reason of request over here. The next type of letter is the transfer. In transfer letter, we have same specialty transfer. We have departmental transfer. So what I mean by same specialty transfer is the, let's say, relocation. GP to GP transfer, right? Old GP is writing this letter to new GP. Nursing home to nursing home, relocation, right? Maybe uh, surgeon to surgeon, maybe ward nurse to ward nurse. So these are few example of relocation, willingly or if the patient is insisting to have the relocation. So in case if we have the relocation, in term of selection, we'll include all the data. In term of selection, we'll include all the data. But in term of organization, focus on active issue. and start from here. But we would write it down each and everything in there. Is it clear? This letter, whenever we have the case notes, we can go to there and we can read it that we are writing this letter to dietitian. So we have to be in the shoes of dietitian. And while reading this letter, we have an idea that we are writing this dietitian for this swallowing function, nutritional status, and high risk of aspiration. So accordingly, we have to read the case notes. As you can see that the last part, there is a choking episode. This is the most important point in the letter. Now, with reference to dietitian, we will start reading the case notes. So we can see there, like, okay, name, these are some intro line, we can write it down. But you can see that, let's say this information might not be relevant for the dietitian. Okay, ischemic heart disease, not directly relevant. We can write it down if you want to do, we at the end, but not relevant. Stroke, not relevant. With reference to the main criteria, just not focus for dietitian, but with reference to the risk of aspiration, we are writing this letter to the dietitian about our nutritional needs. So it would be semi relevant if you write it down somewhere down the grade. Okay, diagnosed with severe dementia, even is not relevant. Diabetes mellitus, yes. Osteoarthritis, yes. Sorry, not important. Diabetes important. Osteoarthritis, not important. Weight gain, yes. Chronic constipation, yes. No allergies, yes. Allergies, okay. This is also important. No teeth. Increased appetite, yes. No, friends, might not be written. Lack of interest, but likes coloring and watching TV, no. But it can reflect the sedentary lifestyle, maybe. Emotional dependence on nursing staff, like not that much relevant, even not relevant. You could skip that as well. Non-smoker, yes, for sure. Chest infection, no importance. Okay, anal cough, no importance, not importance. Yes, it could be yogurt related thing. We can write it down. Yes, and then we have to focus over there. So after writing the introduction part, we have to start from this episode. Like, we can write in the introduction, I'm writing this letter regarding Mr. XYZ or Mr. XYZ, Ms. Sharma, for example, who would require your assessment in order to evaluate her swallowing function, nutritional requirement on urgent basis in order to avoid the risk of aspiration, right? So we can simply write it down, this thing, in this approach, right? So afterward, we can start from there. Like earlier today, around 5 p.m., she presented to the you can say dementia specific, where she is. She presented to us, let's say, with this episode, most probably due to, let's say, we have to spend that, and after that we have to mention the management, whatever has been done, some in summary form, like BSL is also important. Okay, skin color is also important, and then we can write it down, the relevant history from here. Okay, so I hope this thing will be clear to you, that how can we write it down. Thank you.